here is you're stimulating in the brain. Let's say this is your gyrus, central gyrus. So the just a few centimeter will be the motor cortex, and you know for the right side, if you want to test your, let's say, right quadriceps, then you go to the left side of your brain, and then in the left side of brain you roughly know where exactly it will be for your lower limb, and you put your stimulating electrode there. You can put transcutaneous, but you just put actually got a small needle there. So you put there, stimulate that. That will come and record in the spinal cord as a D wave. But unfortunately, if you get anesthetic here, if you have no anesthesia, it will just go to the motor and will record in your quadricep muscles. But if you got anesthetic here, this will block it completely, and you won't get any recording there. So it was quite a decade later, a Japanese scientist called Taniguchi who said that, and it was a simple explanation that rather than giving one stimulus, here you're giving one stimulus. If you give 4 or 5 stimulus, they have an additive effect. So if you see the action potential, the action potential starts when your negative, the resting potential is minus 70. And it has to first come to, let's say, minus 55 or minus 60. And then once it reaches that threshold, then it get all or none action potential. It goes up, depolarization and repolarization. But to reach this from minus 70 to say minus 55 or minus 60, if you give a small potential, it may not reach that minus. But if you get 5 or 6 potential quickly in a quick fire of it, then it just reach that threshold potential, and then you can get a current there. So just remember that you have to, this is called short train of 5 to 7 electric impulses are applied transcranially, and then they go to the alpha motor neuron and they add it to each other. So every time, say from minus 70, first stimulate got it to minus 68, then second stimulus got it to minus 66, then third stimulus goes to minus 60, and fifth stimulus got minus 50. As soon as it gets minus 50, that threshold, then it's all or none, the action potential will come. And this is how we get the compound motor action potential by doing a myogenic evoked potential.